So good day. Today we're going to be discussing about the contraceptives, contraindications. We should avoid contraceptives in head. So I wrote head here for like mnemonic. If you remember your head, remember people who smoke, people with migraine, and people with seizures. For breast, remember breast cancer, and when we go down to the heart, people with history of hypertension, stroke, and cardiovascular disease. If we go to the stomach, remember for pregnancy and lactation. And for liver, remember acute liver disease, cholestasis, and triglyceride elevation. For the pelvic area, remember vaginal bleeding and endometrial cancer. So what are the benefits of COCs is that they decreases endometrial cancer and ovarian cancer, and then they help our bones. It's also confusing, and it has a lot of contraindications and drug-drug interactions. It causes gallbladder disease, cervical dysplasia, and cancer. Why do we use contraceptives? Is to prevent birth and pregnancy. Thank you.